Hello and welcome to Chapter 10. We're going to talk about respiratory pathologies. So we're starting with a fairly clinical picture for a rather esoteric statement that breath and the breathing process are synonymous with life itself. Breathing is one of the most easily observable of the body's vital signs, and one way a massage therapist can assess a client's level of relaxation or anxiety is to observe the breathing patterns. Is the client holding his or her breath while massage techniques are being performed? The effort may mean the pressure is too deep. I've many a time worked on post-operative patients that are in a lot of pain, and that is indeed one of the pain signals, is that they are holding their breath during a stroke or a acupressure maneuver or whatever you're doing that is too painful for the client. Sometimes they will not use their words, they just hold their breath. Is the client breathing shallow and rapid? That might indicate that they're anxious. Is this someone with PTSD? Is this someone with past assault history or other type of anxiety issues? Do you need to ask the client if they are okay and you need to alter your technique or take a break for a moment? Are they beginning to have an allergic reaction? If you see that rapid, shallow breathing, definitely inquire about that to your client. Deep, slow, full breathing indicates relaxation. So you should remember from your advanced anatomy class how the respiratory system works. This image is a fairly good breakdown of the respiratory system and what is involved. If you need a refresher, please read pages 288 and 289 in your pathology book. This next image is of the diaphragm and chest cavity movements during inhalation and exhalation. All right, you see that during inhalation, the chest cavity expands. And during exhalation, when the lungs deflate, the chest cavity becomes smaller. As a reminder, inhalation is also synonymous with inspiration, and exhalation is synonymous with expiration. The breathing process is also known as pulmonary ventilation, and it is controlled by the respiratory center in the medulla oblongata. The respiratory center is automatically controlled in terms of your rate and depth of breathing, but you can override it and you can voluntarily alter your breathing pattern, such as holding your breath during swimming and breathing more deeply during activities such as yoga. So before we delve into the entire chapter, I do want to make two special notes before we begin. The manifestations of respiratory disease or respiratory distress are things to watch out for, like altered breathing patterns if they're getting rapid breathing, difficult breathing, prolonged breaths, or it's very labored. Like it's very difficult for them to get a deep breath, or they feel like they're not getting enough air, which is sometimes called air hunger, with or without exertion. I would mostly be concerned of without exertion. Wheezing, changing in breathing sounds like a high-pitched sound or a rattle or a bubbling sound. If their nostrils are flaring during inhalation, or if they purse their lips during exhalation. Chest or facial pain while breathing. Pale skin, otherwise known as pallor. Definitely look for cyanosis of the lips or fingertips. That's when you'll see some blue coloration. Clubbed fingers and toes. That's when the cuticle enlarges and nail curves downward. We'll definitely look at that later on in this chapter. That's a chronic respiratory disease sign, though, not acute. If your client complains about a sore throat, enlarged lymph nodes, if they are coughing, they may have an infection if they also have watery eyes, a running nose, hoarseness, chills, or fever, or abnormal sputum, like mucus being coughed up from their lungs, anything that's yellowish green to rusty colored, any type of sputum that they're coughing up. These are all things that you really need to watch for and potentially cancel your massage for sure. Now, this image here that's been up the entire time I've been prattling on, of course, is the choking and first aid. It's on page 291 in your book. You definitely need to familiarize yourselves with things like choking first aid, CPR, any of these immediate medical emergencies that may occur in your office. Please educate yourselves, get first aid certification, CPR certification. Definitely know the ins and outs of choking. Just as a personal antidote, what I like to keep around is a device called the D-Choker. It's really cool. It like fits over the nose and the mouth, and it has like a tube that goes over the tongue to depress it and a little bit into the throat, but not like so far that it would set off the gag reflex. And it has like this massive plunger on it that you pull, which causes a suction to pull whatever obstacle is in the airway. It's really cool. I don't know that I would necessarily say have one for your office, because I don't know if you would get in trouble for using one on a client without consent if they were choking, but also it's a life-saving device. Definitely worth checking out, in my opinion. But you do you, and follow the policies of wherever you may be working as a massage therapist. Just make sure that you know the ins and out of first aid, please. All right, our first runner-up is the common cold. So a common cold is an acute inflammation of the upper respiratory tract mucosa. It's usually confined to the nose and throat, although sometimes the larynx can be involved. You'll see coughing, sneezing, watering eyes, nasal congestion, thick yellow discharge sometimes for the mucus, headache, sore throat, hoarseness, slight fever, etc., etc. We know what a cold is. But definitely for massage therapy and common colds, postpone until the client is no longer ill. It usually takes 5 days. Sometimes it can take longer, maybe up to 10 days, especially in those that are a little immunocompromised and don't heal as quickly. There are certainly medications to treat these symptoms, but there is no cure at this time for the common cold, and it is contagious, so definitely postpone those massages. All right, do they have a cold or do they have a flu? Is it the influenza? Now, the influenza is an acute, highly contagious viral infection of the upper respiratory tract, but it can extend into the lower respiratory tract, and that's when it looks like a cold. Now, if someone has a bacterial infection, that can be treated by antibiotics, but both the common cold and influenza are viral, and while there is a flu vaccine, usually it's only for the most common 4 strains of the previous flu season. Influenza is transmitted by infected droplets or touching infected objects like doorknobs, telephones, computer keyboards, shopping cart handles, and then touching the nose or mouth. So if you have a potentially ill client and they've been coughing and then they touch the doorknob and then you don't clean your doorknobs between clients, you've got it. Your next client has it. It's a great fun time for everyone. They do have the same symptoms, the cold and the flu usually, except for the flu typically has a higher fever when there is a fever onset, and it also affects the upper respiratory tract rather than just the lower respiratory tract. There's also significantly more muscle pain and fatigue. There also can be a fever lasting more than 5 days. So to prevent the spread of infection when it comes to massage therapy and the flu, the massage should be postponed until a minimum of 24 hours of no fever without the use of fever-reducing drugs like over-the-counter, things like ibuprofen and acetaminophen. Sinusitis is an acute or chronic inflammation of the mucosa that lines the paranasal sinuses. Most cases of sinusitis are acute and resolve in 4 weeks or less. When it's recurrent or lasts longer than 12 weeks, it's considered chronic sinusitis. When the sinus mucosa swell, the openings become obstructed and it creates a buildup of secretions, usually causing a headache and facial, sometimes even teeth pain that intensifies quite a bit when bending over as pressure increases. Facial tissues might swell, the skin under the eyes sometimes becomes discolored, and the person has difficulty breathing through the nose. Sense of taste or smell may also decrease, and there's usually a yellow-green discharge. Sometimes this may induce coughing and sore throat. Fever sometimes accompanies acute cases, especially if there's infection, but not typically the chronic cases. Now, when it comes to massage therapy and sinusitis, massage is contraindicated during the acute episodes while the client is experiencing fever. Always wait 24 hours after the client has had a fever without taking over-the-counter medications. However, when it comes to massage therapy and chronic sinusitis, you can absolutely engage in massage. There is a method of applying pressure over the forehead, on the eyebrows, and down the bridge of the nose. You can hold each point according to your book. I like to do stroking methods that are a medium pressure, going medial to lateral, and then working from superior to inferior on the face to drain downward and outward. And there are also some amazing craniosacral techniques that help lift and open the sinuses by doing light pressure on the supraorbital ridge and also on the zygomatic arch. Those are absolutely fascinating. If anyone is interested in sinusitis techniques, we can definitely find those and pop them in the extra resources section for you. It is very effective, and for people that suffer from chronic sinusitis, they think you're a hero. Our next runner-up is pharyngitis. Acute or chronic inflammation or infection of the pharynx is called pharyngitis. It's usually a symptom of a disease like the common cold or sinusitis, mononucleosis, or the flu, and it's not actually a disease itself. It's simply a symptom. Strep throat is actually a type of pharyngitis. Pharyngitis can also just be called a sore throat. If someone has difficulty swallowing, a sensation of having a lump in the throat, depending on the cause, it could also be accompanied by a low fever, enlarged cervical lymph nodes, sneezing, and coughing. Now, when it comes to massage therapy and pharyngitis, you need to ask the client about the cause of the pharyngitis. If it's the result of an infection, obviously wait the 24-hour period after a fever. For non-infective causes, massage can be performed. Make sure there's no fever and nothing contagious. Don't make them speak. Allow them to minimize speaking because their throat is sore. You can use nonverbal forms of communication such as shaking the head for no and nodding the head for yes in response to closed-ended questions, or use a computer screen, tablet, or notepad to read responses entered by the client if they cannot talk without severe pain. Laryngitis, not to be confused with pharyngitis. Laryngitis is an inflammation of the larynx, and this is a sign of a disease as well. It is a sign or symptom of something else such as the common cold, the flu, or pneumonia, and not an actual disease. It's usually acute and lasts less than 1 week. If it's considered chronic, you've had it more than 1 week rather than our typical 3-month period. Main signs of laryngitis are hoarseness and loss of voice. Other signs and symptoms include fever, painful swallowing, coughing, sneezing, and a dry and scratchy throat. If they have that might be indicative of a respiratory infection. When it comes to massage and laryngitis, Ask them about the cause. If the laryngitis is a result of infection accompanied by fever, wait your 24-hour period. And then for non-infective causes of laryngitis, you can perform massage just like with pharyngitis, which is a sore throat, laryngitis, which is a loss of the ability to speak. You can use non-verbal forms of communication if it's appropriate with your client. Laryngeal cancer involves tumors in the larynx. There's approximately 13,500 new cases and over 3,600 cancer-related deaths in 2016. Now, remember, when I am talking about prevalence in this pathology book, we are focusing on the United States. That is where you are currently seeking licensure. So we are talking about your non-foreign tourist client pool. So a small percentage have laryngeal cancer that will be potential clients for you. Most cancers are caused by frequent or persistent exposure to carcinogens, which are cancer-causing agents. The common risk factor for laryngeal cancer is heavy tobacco use combined with chronic alcohol use. Other risk factors are occupational exposures to chemicals, such as asbestos, also poor nutrition, and the papillomavirus infection, HPV, all right? Gastroesophageal reflux, acid reflux is also a risk factor, and it has a first-degree relative with laryngeal cancer. So just keep that in mind. Poor nutrition, constant acid reflux. These are sort of silent symptoms that could lead up to laryngeal cancer. If your client has cancer, please ask about current signs and symptoms, as well as any side effects of cancer treatment. Clients with respiratory diseases benefit from certain body positions to help them breathe more easily during the massage. And while the client is supine, elevate the client's upper body and head while resting the knees on the bolster. When the client is side-lying, elevate the client's head and place a pillow between the knees. If the client is seated, be sure the client's feet are flat on the floor with elbows resting on the knees. Avoid the prone position, or at least try to limit time in the prone position. Especially for the clients that are obese, this can cause breathing difficulties. Mononucleosis. Mono is an acute contagious viral disease that often presents as an upper respiratory tract infection that includes the nose and throat. It's most common in people 15 to 21 years of age and is rarely seen in people older than 35 years. A lot of people call it the Epstein-Barr viral infection or the kissing disease, if you hear a client call it that. Signs and symptoms usually begin slowly and include a sore throat. There's usually complaints about an incredible amount of fatigue, headache, loss of appetite. There can be fever, red throat, a soft palate, coughing, and enlarged lymph nodes. Sometimes you can even see a petechial rash. Other conditions also develop along with this, such as strep throat and tonsillitis. And it's rare, but there's a serious side effect that you could have. A complication is an enlarged spleen. Massage is completely contraindicated until the client has fully recovered. It is a contagious viral infection. Do not massage the client if they say they have mono. All right, those were all upper respiratory tract infections. Next, we're going to talk about pneumonia. Pneumonia is an infection or inflammation of the lungs. According to the CDC, approximately 1 million people in the U.S. seek care in a hospital due to pneumonia, and 50,000 people die on average from it yearly. It's often preceded by the common cold or influenza. Signs and symptoms include coughing, shortness of breath, even at rest, fever up to 105 degrees, and chills. Other symptoms are headache, chest pain, fatigue. There's also walking pneumonia, which is a type of pneumonia associated with mild symptoms, and the infected person is often unaware that he or she is ill, even though they are contagious. Affected individuals may notice a scratchy or squeaky noise in the chest when breathing deeply. So if your client has this contagious respiratory issue, a massage is obviously contraindicated until the client is recovered completely. Sometimes your healthcare provider, or I should say the client's healthcare provider, will recommend postural drainage techniques, which can be performed by a massage therapist while the client is recovering. But there's no reason that the client cannot also do these postural techniques if they are physically able to on their own without potentially giving you their contagion. We will go over that image in just a moment. All right, bronchitis. Bronchitis is an inflammation of the bronchial mucosa with resultant swelling and mucus hypersecretion. All right, you can have acute bronchitis and chronic bronchitis. Acute bronchitis is usually following a viral upper respiratory tract infection, and acute cases resolve themselves along with that respiratory infection. Signs and symptoms are a productive cough with copious amounts of sputum, a slight fever, chills, fatigue. Those usually subside within a week. People with chronic bronchitis have productive cough that is more pronounced in the morning because secretions have pooled while they sleep. Chest pain may develop from the effort of severe coughing, and other signs and symptoms are sore throat, exercise intolerance, fatigue, wheezing, and shortness of breath. Now, when it comes to massage therapy and bronchitis, it's contraindicated if the client has acute bronchitis accompanied by fever. We follow the same 24-hour fever-free protocol, but if they have chronic bronchitis, ask about medications such as an inhaler that are used to improve breathing. If they have an inhaler, put it in a location that's easy to access in case they need it immediately during the session. Clients with respiratory diseases may benefit from certain body positions, so we are going to talk about that next, especially those with pneumonia that we've just discussed and bronchitis. All right, so this image shows you some of these postural drainage positions. In some instances, a healthcare provider will recommend the postural drainage techniques to assist in clients from removing phlegm from the lower respiratory tract. So it is what it looks like. You are trying to drain the mucus out of the body. So we have a lot of these head downward positions. I will say for clients that have high blood pressure as well, please make sure that these are actually indicated for that particular client. You can also have a client hunched over in this seated position, hugging the pillows. That drains the posterior segment of the upper lobes, but it doesn't do much for the lower lobes. You really need these lying positions, either side lying or prone in some cases, although laying prone does make it difficult for some of these clients to fully inspire. They cannot fully inhale or get a deep breath laying prone. So please be careful of that. Anytime I have done these, I have always kept a spit bucket. I keep like a small can or a bucket with its own bag already in it, usually with a paper towel or something to absorb some of that wetness in the bottom of it for them to be able to cough into. This next image is stretching the thorax. We're going to talk about COPD in a minute, but with all of these respiratory diseases, a lot of these people often have a tight or restricted thorax from chronic coughing. So you can place a rolled up towel or a large bolster across the massage table and just have them lie supine with the towel roll placed across the spine just beneath the level of the inferior angles of the scapula. So that's just below the shoulder blades, okay? We want it right at that kyphotic arch of the thoracic vertebrae. So we're going to be pushing that arch upwards just a little bit. You can adjust the height of the towel roll so that it feels comfortable for them. If you find that your bolster is too small, you can add a towel onto it. Just adjust as needed. And allow the client to relax in this position for up to 5 minutes. You can see in this image that the person laying on the table also has a towel underneath the neck that helps extend and put the proper curve back into the cervical vertebrae. A lot of people nowadays have military neck or straightening of the cervical vertebrae. Thank you, smartphones. Make sure their arms are open. As shown in this image, they can keep them at a 90-degree angle or they can be fully extended, but we absolutely want to open up those pec muscles as well. I would not pull them all the way up so that the arms are next to the ears. I would keep them as wide and as open and as abducted as possible in this position. And in this other technique image, we have cupping percussion, all right? This person is cupping, their hands are cupped, as you can see in the image, and they're tapping on what appears to be the area over the lower lobe of the lungs. You can also use your fingertips to tap in percussive motions. You can also use the loosed fist or a slightly closed fist to do beating gently in this area. That helps break up phlegm. It is incredibly useful in people with COPD, which is chronic obstructive pulmonary disease. There are a lot of fantastic techniques. You might want to have them tilted slightly down in a postural drainage position when you do this. And again, just my 2 cents from personal experience and decades in the massage office. In medical settings, please have a spit bucket ready with a bag in it. The last thing you want to do is wipe out the bucket. Before I jump back into the list of respiratory pathologies, let's just take a quick moment to take a peek at these. These are the muscles of respiration. Okay, so we are looking here at the primary muscles of inhalation, which are the diaphragm. That's the main muscle of inhalation. The external intercostals, all right? Those are the outermost muscles in between the ribs. The accessory or secondary muscles of inhalation are the scalenes, the sternocleidomastoid, the pectoralis minor, the serratus anterior, and the serratus posterior superior, which is why this thorax stretching technique we are looking at is so effective. All right. During normal respiration, exhalation is a passive process, whereas you're using muscles to actively inhale. The active exhalation is just a passive process and doesn't actually require muscular effort normally. Of course, when you force the air out, you do activate musculature, but very often it's just a letting go and a deflating. The accessory muscles needed for forced exhalation are the internal intercostals. We want to pull those ribs back down. The serratus posterior inferior and the abdominal muscles. When we are contracting those abdominal muscles, we are pulling on that diaphragm. If we're working those inner intercostal muscles, we're making the insides of the ribs pull back in together, whereas the external intercostals pull the ribs upward and outward to allow for expansion of the thorax, which increases the space needed for inhalation or inspiration. All right, moving onward and forward with our diseases. We're going to talk about tuberculosis, which is a lung infection. It is one of the top 10 causes of death worldwide and is responsible for nearly 2 million deaths annually. And now this is by the World Health Organization, so it has made me a liar. That is a global number, not a USA number. Your book is tricking us. The number of deaths is fueled by the spread of human immunodeficiency virus, HIV. Poverty, lack of medical services, and the emergence of drug-resistant strains of the disease causing bacteria. Another more recent prevalence that is being spoken about in the medical community is the anti-vaccine crowd, really pushing for people to not receive TB vaccine. Treatment is antibiotic therapy. In the past, people who had active TB were quarantined in sanitariums. Now, usually they're treated at home until the sputum cultures indicate complete eradication of the active bacilli. This period can be as long as 6 months in treatment-compliant people. In some cases, it takes over a year of being in quarantine and receiving antibiotic treatment to clear yourself of tuberculosis. For clients with TB, massage is absolutely contraindicated. It's contraindicated during secondary TB. If they've had a recent skin test, avoid the site until the test is read. I personally, if they've had a test, I would not massage them at all until after the test has been read. I would not treat it as a local contraindication. I would actually just not massage them at all. Unless they're getting tested as part of a work site evaluation, like if you want to go work at a hospital, you get a mandatory TB test. But if they're being tested because it is suspected that they have TB, protect yourself, please, and just postpone it until it is read. As with any client who's dealing with long-term illness, post-TB, you can definitely work on them, but note their muscle strength, their walking speed, everything that would indicate whether or not they have a low vitality, and definitely treat them the same post-TB as you would any other client who has been suffering from chronic respiratory issues. This image, just so that you're aware, is a positive tuberculin skin test. This is what it looks like when they have a reaction to the TB skin test. Next up, we have pleurisy, which sounds like an 80s band name. Pleurisy is an inflammation of the pleural membranes. 2 types of pleurisy are wet and dry. Wet pleurisy refers to an increase of intrapleural fluids called pleural effusion. Dry pleurisy is essentially a reduction in intrapleural fluids. Pleurisy is also called pleuritis. All right, signs and symptoms. It's characterized by a burning or stabbing pain during inhalation. Painful respirations are caused by the friction created as swollen pleural membranes rub against each other. Respirations are typically shallow and rapid. Coughing, fever, and chills are also frequent disease manifestations. Massage is postponed until the condition has been resolved. After recovery, massage should focus on the primary and secondary muscles of respiration. We couldn't talk about respiratory issues if we didn't also talk about lung cancer. Lung cancer is a malignancy of the lungs and considered an epidemic, with approximately 225 new cases and 158,000 cancer-related deaths estimated by the American Cancer Society for 2016. Signs and symptoms of early-stage lung cancer are likely to be attributed by the individual to effects of smoking, including a persistent cough, blood-streaked or rust-colored sputum, shortness of breath, wheezing, chest pain, hoarseness, and recurring bouts of bronchitis and pneumonia. If you are massaging a client who is experiencing symptoms or signs of lung cancer, ask about those as well as the side effects of cancer treatments. Follow their primary health care physician or their oncologist recommendations, and please be aware of therapies regarding post-surgical situations, radiation, especially with radiation rashes or blisters, and the side effects of chemotherapy. Again, please be aware of proper bolstering and positions for these clients and avoid the prone position or limit the time spent in this position as much as possible, which, yes, means most of your back work will be done in the side lying position for these clients. One of the most common ones, asthma. Asthma is a bronchospasm that causes breathing difficulties in susceptible people. This condition is usually caused by an allergic reaction or another form of hypersensitivity. It can be also brought on by an anxiety attack. If your client has asthma, make sure that they have their rescue inhaler if they use one close by at all times during the session. Signs and symptoms of an asthma attack include wheezing, prolonged exhalations, shortness of breath, a sensation of chest tightness, and sometimes profuse sweating. They may appear anxious and unable to speak more than a few words without stopping to breathe. They may cough and produce sputum. They may also have cyanosis, which is the bluish skin color, or pallor, which is paleness or lack of skin color. Most asthma attacks are mild, with freedom from symptoms between episodes. Okay, so if you are massaging someone who has asthma, during the intake, make sure you talk about allergens. Make sure that none of your aromatherapy or lotions or oils or even laundry detergents are going to set your client off. Ask about medications, again, such as their inhaler if they need to grab it quickly during the session. Massage has been shown to have incredibly positive effects on both children and adults with asthma. Children with asthma experience decreased anxiety and reduced cortisol levels after receiving massage. Absolutely. Again, I know I keep bringing up the Miami Touch Institute. Please refer to some of their manual therapy studies regarding asthma and other respiratory conditions and manual therapy, such as massage. No, this is not a Christmas serving of blood pudding. This is emphysema in your lungs. Emphysema involves permanent enlargement of lower airways accompanied by the destruction of alveolar walls, affecting their elasticity. They can no longer stretch with inspiration. Obstruction results from changes in lung tissue rather than mucus production and inflammation that you normally see in things like asthma and bronchitis. All right. Signs and symptoms of emphysema are shortness of breath, breathing through pursed lips, and wheezing with prolonged exhalation. Added exertion during exhalation increases the size of the rib cage, resulting in a barrel chest, as we can see in this next image. If your client has emphysema, ask about medications such as inhalers. Obviously, keep it close by if needed during a session. Please focus on primary and secondary muscles of respiration. Long-term management for those with emphysema include stopping smoking, inhaled bronchodilators, improved nutrition, and corrective breathing techniques. Advanced cases may require the use of supplemental oxygen. If that is the case, please inquire about any medical devices that your client may have. This image here is the quote-unquote tripod position. It is for relaxing the respiratory muscles. They're leaning forward, placing the hands on the knees. Your book often suggests placing the elbows on the knees, which further shortens the torso and hunches it in, which honestly confuses me. This image with the hand on the knees sort of allows the accessory respiratory muscles of the neck and upper chest to be activated while breathing, while kind of relaxing the lower portion of the thorax. What concerns me about telling your client to lean fully forward with the elbows on the knees is that you are really constricting the space available for inspiration with the thorax. But leaning with the hands on the knees like this does relax the body posture and allows the upper respiratory muscles to help work rather than using mostly only the lower muscles of inspiration. That was certainly a lot of words about sitting, and I hope they made sense. This image here is the clubbing of the fingernails that we had brought up before. You can see the 3 stages, but I really want you to pay attention to the severe stage. Not only is the fingernail sort of curving all around the front of the fingertip there as it grows, and it's become more convex going around the fingernail, but you can see where the cuticle is actually being raised, and you can see it is darker. That's supposed to indicate a blue tint, signaling cyanosis or lack of oxygen there. Our next respiratory disorder or disease is pneumoconiosis. Pneumoconiosis. Say that like 5 times fast. This almost looks like miner's lung. It's even worse than emphysema. Lung disease is caused by long-term dust inhalation, usually occurring in the workplace. Pneumoconiosis. This dust deposits, which are permanent, contribute to chronic inflammation and infection. Now, this isn't just dust. This is chemical dust, debris in the air. Asbestos is the most common type causing pneumoconiosis. You can also get coal miner's lung. Ooh, I called it just from this image. Black lung and silicosis. This chart shows you some of the medical names for these particular dust inhalants that are causing these troubles, what their common name is, the causative agent, whether it's fungal spores or asbestos, and the industry that it's coming in. This is very common, some countries more than others. This is why we need to fight for workers' rights and a whole lot of EPA regulations. I know that we hear a lot about political fights, but these things are more common than you can imagine in the workplace. Now, when it comes to massage therapy and these conditions, again, ask about medications such as an inhaler. This is not a contagious issue. These are caused by long-term inhalation of causative agents, all right? Again, they're going to get some relief from positional drainage if they have extra mucus or phlegm production. As with any client who's dealing with a long-term illness, ask about their vitality, ask about pain threshold, ask about their ability to sit through a long massage if it needs to be 30 minutes versus 60. Sensitivity to touch, sensitivity to positions for breathing. You might have to avoid the prone position with these clients as well. Just stay in constant communication with these folks. Here's a scary one, bronchiectasis. Bronchiectasis. The description of this is irreversible dilation of the bronchi arising from infection or inflammation of the airways. These dilations weaken bronchial walls. The fluid-filled sacs form in these areas that are not easily cleared, and they obstruct airflow. The stagnant pools of mucus breed bacteria and infection. Bronchiectasis is the most common complication of chronic bronchitis and can be seen in conjunction with other respiratory diseases such as TB. You can see chronic cough, overproduction of mucus, shortness of breath, wheezing, and fatigue. Sometimes fever can be present in the case of an infection. They may cough up bloody sputum and have foul-smelling breath. Remember, bad breath is called halitosis. They can also have clubbing of the nails, and the fingertips may be cyanotic. Remember, that's being tinted blue from deoxygenated blood. All right. Massage therapy and this condition. First, again, figure out if it's caused by an infectious disease. If so, you need to avoid massage therapy. Avoid them for 24 hours after fever has cleared. Ask about medications if it's not caused by an infection, if this is caused by chronic issues. Again, keep that rescue inhaler close by during the session. This is another condition where you're going to want the phlegm bucket. Put a bag in it. I'm promising you're only going to want to disinfect the can, not wipe globs of coughed up things out of it. In this particular case, it will be smelly. Also ask about vitality for these clients. These clients tend to be weaker. They are dealing with chronic respiratory issues and feel like they are not getting enough oxygen to fuel their body. Next, we have cystic fibrosis. It's a genetic disorder that causes hypersecretion of cells that produce mucus, saliva, and digestive juices. These thick secretions narrow and obstruct the respiratory and digestive tracts. Many organ systems are affected, and it is the most common fatal genetic disease in white children. 1 in 2,500 will die from this. It affects boys and girls equally, and according to the Cystic Fibrosis Foundation, the average life expectancy is close to 40 years. Death usually results from respiratory failure. Cystic fibrosis is also called mucoviscidosis. Antibiotics are typically prescribed for lung infections with the addition of mucus-thinning drugs and bronchodilators. Postural drainage techniques are often used to loosen and help expel the phlegm. So when it comes to massage therapy and cystic fibrosis, of course, you're going to ask if they have a current infection. If they do not have a current infection, you can definitely work with them. Anxiety levels have tended to decrease in both parents who gave massages and in children with cystic fibrosis who receive massages daily, according to multiple clinical studies. Again, they're going to benefit from the postural drainage techniques. This is one you would definitely want to use percussive treatments on the thorax. Again, ask for any medications that need to be nearby during a session, and you're going to want a bucket nearby for this one as well. Again, this is another one that you want to check for vitality. You might need to do different modifications, such as fewer changes in body position, and you might need to use a lighter pressure and slower speed with your massage modalities. Our next runner-up is obstructive sleep apnea. It's a temporary cessation of breathing during sleep. Usually lasts about 15 seconds, or the absence of spontaneous breathing during sleep. It's more often seen in men than in women. And obstructive sleep apnea is the most common type of sleep apnea and occurs when the upper airway is blocked. An estimated 22 million Americans have obstructive sleep apnea. Most cases are associated with obesity. You can also have structural blockages, such as overgrowth or a cyst in the area. There is also central sleep apnea, which occurs when the brain fails to transmit signals to breathing and intercostal muscles and accounts for less than 10% of cases of apnea. All right, central sleep apnea is associated with heart disease and hypertension, which basically means you can't get enough air at night. You can end up developing side issues such as various cardiac problems. People with apnea usually have an incredible amount of fatigue and brain fog as well. They may snore loudly during the night. They have episodes of breathing cessation followed by any type of nap or deep sleeping, followed by snorting and gasping as the body starts to awaken, experiencing a need for air. They may also suffer from insomnia and sleepiness during the day. Other symptoms may be waking up with an early morning headache, waking up with a dry mouth and sore throat, and sometimes depression. They frequently do not feel rested when they wake up after having a full night of sleep because they weren't truly sleeping all night. Now, when it comes to massage therapy and obstructive sleep apnea, ask them about their usual sleep positions and whether they have difficulty lying on their back for extended periods of time. If that's the case, you do not want them supine for a long period during your massage therapy session. Use their preferred sleeping position for the majority of the massage. If prone is not an option, you can massage their back when they're either sitting or in the side-lying position. Relaxing massages are indicated and do help decrease anxiety and offer relaxation for clients who suffer from this. If your client falls asleep, which is definitely possible during the session, they may experience an apneic episode. They will often wake suddenly while snorting or gasping. It's most likely going to occur when they're lying supine, but it can occur in other positions. So just be aware, if you're massaging them and they get relaxed and they fall asleep, they may suddenly wake up startled, possibly in pain, gasping for breath during your session. Just as an FYI, this is a CPAP machine. This is the most common treatment usually used for sleep apnea at the time. CPAP stands for continuous positive airway pressure. It's just pushing air into the mouth or the nose or both, and it allows the person to have a positive flow of air into the airways to help keep them open. Most people who start using these devices with sleep apnea have increased energy and mental clarity because they are able to sleep more soundly. Up next, we have pulmonary edema. This is a condition involving excessive amounts of fluid in the lungs. This edema interferes with the lung's ability to expand during inhalation and reduces gas exchange. Pulmonary edema is most often a complication from diseases. So signs and symptoms are wheezing, coughing with frothy, bloody sputum. Affected people are anxious and may feel like they're drowning or they're suffocating. Another important symptom is shortness of breath that is more pronounced when the person is lying flat. Pulmonary edema is a medical emergency, so you're not going to do a massage. It requires immediate medical attention. Massage is postponed until the condition resolves. Absolutely. If someone is coughing up frothy, bloody sputum and they feel like they're drowning, please call 911 immediately. Our next one is pulmonary embolism. This occurs when a blood clot or foreign object causes partial or complete occlusion of a pulmonary artery or one of its branches. We've already covered this in the cardiovascular system a little bit. Signs and symptoms of pulmonary embolism do not appear until an embolus has lodged in a pulmonary vessel, and clinical manifestations depend on its size. Small emboli produce symptoms of coughing, shortness of breath, and mild transient chest pain. Larger emboli, the person experiences shortness of breath and chest pain that intensifies with deep breathing or while coughing. Eventually, fever is present with the production of bloody sputum. Massive embolus leads to a sudden onset of symptoms such as rapid breathing and a crushing chest pain, but with rapid and a weak pulse. Loss of consciousness and death may follow. Obviously, pulmonary embolism is a medical emergency requiring immediate medical attention, so massage is postponed until the condition resolves. All right, our last little bit here is about immune disorders. Primary immune disorders of the respiratory system are hay fever, asthma, and allergies. We've already talked about asthma earlier, and we've touched on allergies, but just a brief note about hay fever, because I don't think we've talked about hay fever. Hay fever is a general term used to describe any hypersensitivity of the nasal mucosa to allergens, usually plant pollen. It occurs annually in approximately 1 in 5 people in the United States. So 20% of the USA has an issue with hay fever. It's also called allergic rhinitis. Hay fever is characterized by sudden attacks of sneezing, swelling, and profuse watery discharge of the nasal mucosa with itching and watering of the eyes. The skin under the eyes is often swollen and bluish, called allergic shiners, and the person may experience coughing. The symptoms of hay fever are similar to those of a common cold, and distinguishing between the two conditions may be difficult. All right. This figure here is a friendly little dust mite. It's one of the causes of hay fever. Usually putting your finger on the asthma trigger, allergens, or irritants is pretty difficult. Obviously, you can get allergy testing done. Hay fever is not contagious, and you can definitely work on the client who is suffering from this, although I would definitely have tissues available because they will have watery eyes and definitely a watery nose.